gentlemen, welcome on stage Mr. Kiran, CEO of ekincare, to deliver the track keynote on Reimaging Employee Wellness. Mr. Kiran.
Good afternoon, everyone. I would first like to thank NHRD for giving us this opportunity, and more importantly, congratulate NHRD for 22 years. It's amazing to see a not-for-profit organization by HR for HR, and the amount of participation across this event. So one of the key topics that we are here to discuss is how can we improve an employee health, right? Which is the most important capital for any company, which is the human capital, right? And let me start with a simple quiz, right? So I'm sure there are quite a few leaders around from various parts of India, but let me ask you a question as to which one do you think is the healthiest city when it comes to corporate health currently? Chennai, how many guys do you think Chennai is the healthiest city? Raise of hands. How many guys do you think Bangalore is the one? Or which one do you think? Absolutely correct. Pune is the one which is the most healthiest city when it comes to employee health, right? When this is a survey done across more than 250,000 corporate employees across India, and Pune, as you see, ranks higher than any other city in India, right? But there is a small catch here. If you see, none of the cities have crossed 700 or 800, which means while Pune is the number one, other cities, Pune is also bad when it comes to employee health, right? Everybody is below 600. So a lot of effort and energy needs to go in to actually make sense of an employee health, right? And today, if you look at it, why does it matter? Why does it actually matter? Is if you look at the lifestyle diseases, right, those are growing at an alarming pace of 20% in the next 5 years. And this is no secret. If you look at the trends, why this is growing is because of the likes of Swiggy's, Zomato's, high household income, disposable income, younger population coming to workforce, eating out too much, drinking out too much, partying harder, right? And all this is actually taking a toll on your human capital, right? And if you look at it, the top 3 conditions here, right? If you look at the survey, the top 3 conditions: obesity, absolutely, of course, yes. US was once called the obese capital of the world, but if you now look at it, we are not too far away. And the second biggest condition is the chronic back issue. So how many of you have ergonomic sessions or have thought of ergonomics within your companies? Raise of hands. Excellent. At least, I mean, there's few hands. But if you look at it, an employee is sitting on their chair, right, at least for 4 to 5 hours in a day. If you are spending a good amount of money on buying a house, if you are spending a good amount of money buying a nice car because you're going to travel in it, what should you do for sitting on a chair where you are going to spend 4 to 5 hours in a day? Shouldn't you get a really good chair that is comfortable, fits your, and the desk, so that the most important thing is your posture is taken care of, right? So these are all simple things that we could look at actually to improve the employee health, or which is critical, right? And if you look at it in terms of the trends, right? I mean, sorry to say, but if you look at this room, 1 in 3 are at risk of hypertension, which is blood pressure, right? And India is 60% of the heart, heart patients are in India. Of the world, heart patients are in India. So these are all alarming stats when you look at it. I'm not here to actually frighten anyone, but this is factual information, right? And if you look at it, why employees are actually starting to think about all of this, right? I mean, if you look at individuals now, there is a lot more effort being put by individuals to actually stay healthy. And if you look at it, 66% of them are actually looking at saying, I need to improve my diet. Almost 50% of these employees are saying, I need to improve my fitness levels. And if you look at it, this is across urban, high affluent population, right? So all your employees are starting to think that A, my health is important, B, I need to do something about it, and more importantly, how can the companies help me do that? How many of you, again, sorry to ask too many questions, but how many of you have health insurance for your employees? Excellent. And how many of you do corporate wellness as part of your health insurance plans? Understood. So let me ask you this, right? So while you're doing this as part of the insurance, while an insurance company is providing this to you, did it ever struck you that there is a conflict of interest? Because an insurance company is, or you're working with a broker in between who's actually monitoring and providing these services for free, and a typical broker, insurance broker that provides these services, their business model is based on claims. And here you're asking them to actually reduce the claims. If you're working with somebody like a third-party administrator, their business model is based on the amount of claims that they process. And here you're asking them to help you out with reducing the claims. And that is where the change in thought process has to come across, saying that, no, let me take the ownership within my own hands. Let me look at it as an independent entity or an organization, and let me start working towards it without actually having a conflict of interest. And there are a lot of initiatives that we do in terms of health insurance and all, but if you look at it, only 5 to 6% of them actually use health insurance. And the way we are actually doing it is waiting for somebody to fall sick and then helping them. That's pretty bad, right? So essentially we want to take care of our employees, but we're waiting for them. We're only helping them if they fall sick, versus trying to help them improve their health from falling sick. And at the same time, if you look at it, wellness is not something that is done as a stepchild, and I'll talk more about it, right? The other interesting fact is, if you look at the amount of money that your employees are spending, right? If you look at the top metros, almost 30,000 rupees is being spent by each one of your employee in their out-of-pocket expense to ensure that they are taking care of prescriptions, preventive side of it. And if you average it out across India, that's roughly around 9,000 rupees. So a significant portion of it is being spent by employees to take care of their health. And that too in terms of taking care of their family's health. And this is where, when we surveyed a lot of corporate HRs in terms of what are their priorities, right? And interestingly, 50% of them said employee health and wellness is a priority for them. They want to start focusing on it. But let me ask you this, glean upon it a little more. Within your, as there are multiple leaders out here, if you look at your companies, there is a leader for comp and benefits. There's a leader for recruitment. There's a leader for learning and development. Do you guys have an independent person who's actually looking at employee health and wellness? Is there a KPI, KRA, OKR around employee health and wellness? Are you actually tracking it, measuring it, and saying, how can I improve it better? Almost 70% of the companies that we work with, it's either a part-time function of some HR, or it is like done by admin. If you believe that it's important, why is there no leader for it? And that is where a lot of this comes into the picture in terms of how do we, where the current processes are completely broken. I mean, this is based on, so today we work with more than 150 companies, Fortune 500 companies across India. And when we actually approach these companies, right, it was alarming to see there's no data at all. So you're spending, but you're not tracking. You're spending, but you don't know where you're spending. You're spending, but you don't know on who you're spending. You're spending, but you don't know what is the risk within the company. And none of it is measured, none of it is outcome-based. Everything is driven based on utilization, and you're spending for engagement, but not for outcomes. And which is the reason why 62% of these employees that we interviewed said there needs to be improvement in how these programs should be administered. And that is where we move into the next chapter. All of this has to be reimagined ground up. And when I say reimagined, if you look at it from a three-pronged approach, there is process, there is people, there is technology. Just like any other department, whether you take L&D, whether you take comp and benefits, whether you take recruitment, when it comes to health and wellness, it has to be thought from ground up. And if we talk about people, right? For most of the companies that we speak to, unfortunately, it's a checkbox. Yeah, I've done my health checkup, I've done one Zumba session, I've done one doctor talk, done and dusted. We'll talk about it next year. I'll give you an example. So there was this large company, a cloud-based company out of India. They called me up out of the blue in one day, and they said, Kiran, please come urgently. We need to do something about corporate health. And as a client calls, we run, getting excited, we get there, and the discussion is, we need to do something urgently about employee health because there was a fatality within the company last week, and we believe the fatality happened because the person is a smoker. So let's do a smoking cessation program. Or not even a cessation program. Let's do a smoking talk, why smoking is bad. So these are all knee-jerk reactions which don't yield any outcomes. And first of all, the assumption could be completely wrong. The person could actually have a family history of diabetes. The person was actually depressed. The person may have stopped taking medications. It could be n number of things. It's like shooting in the dark right now. And that can only be taken care of when you're constantly engaging with your employees, just like you're engaging for learning and development, right? If you're reskilling your employee base, if you're reskilling your human capital, it has to be a continuous initiative. It can't be once in a year, beginning of the year or during the renewal. It has to be a continuous program. And more importantly, if you look at it, and I'm sure you agree with it, if you look at your employee base, it's broken down into 3 segments. We call it our customer segmentation. We call the first segment invincibles, right? Invincibles are less than 30 years. They don't care about health. Even if you tell them to go do something about health, they'll just laugh and leave, right? Then the second segment is the first attack. They just got married, they just had a kid, and they saw somebody in the family fall sick. They're starting to get afraid about health. They're starting to think about health. They're the ones who are looking at insurances. They're the ones who are looking at how can I protect my family. And the third category is the chronically ill. This segment is past the stage where they've already are diabetic, hypertensive, they had a heart condition. They just need to maintain their health. Now, as you are running your corporate programs, you are looking at it as one size fits all solution where you do one health checkup and say, done, dusted. There is a different journey, there is a different process, there is a different objective and a different outcome depending on each segment. And that is only possible if you're continuously engaging, if you're continuously collecting the data, if you're continuously improving in terms of how to catering to all these segments. And then all this is possible because it's a lot of work. Just like any other department within the human resources, even this is a lot of work. It requires continuously evaluating, collecting, rethinking, coming up with creative ideas. And that is not possible through, I would say, manual efforts. And that is where technology plays a very big picture, right? And that is where data analytics, that is where AI. A simple example is if we look at this room, just like everybody has a thumb impression which is unique, right? Every one of us have a unique health graph. Our family histories are different, our medical history is different, our lifestyles are different, what we eat is different. Then how come we all are thinking of the same way to do things? And that is where AI comes in. A simple example is, let's say a 35-year-old with a family history of diabetes who smokes. The cadence for a follow-up health check is completely different from somebody who doesn't smoke. And somebody who's running a marathon, their health cadence is completely different from somebody who's sitting at desk and not even taking 1,000 steps a day. So that is where AI comes into the picture, which is constantly looking at the data, which is constantly personalizing the journey of an individual and constantly nudging them towards improving their health. It can't be a one-size-fits-all solution. And more importantly, it has to be mobile first. This is an era where everything from buying a movie ticket to ordering dress to everything is done at the click of a button. It has to be mobile, it has to be simple, it has to be catered to multiple different audiences. And at the same time, yesterday and today I've been speaking to a lot of you leaders, and if you look at it, yes, all of you are doing tremendous job, but all of you are doing it in silos. For example, there's somebody who's doing health checks, there's somebody who's doing doctor consultations, there's somebody who's doing something else, you have a medical center, but if it's not looked at as a unified approach, if that data is all not coming together, then you are not actually making sense of what you're doing, right? Because if you are able to collect that data, what cannot be measured cannot be improved. If you're doing it, I would recommend or I would suggest do it in a more advanced fashion where you can start collecting all this information and continue to engage employees and measure, quantify every little activity that you're doing within the company. And once you measure, once you identify where your risks are, and once you know where to focus on, then you can start doing a lot more for that particular population than trying to do one-size-fits-all approaches. And it has to be a culture. It can't be a part-time job of some multiple leaders working on it as a part-time. It has to be a culture where it flows down. I'll give you a small example. It doesn't have, the rewards and recognition in this scenario doesn't have to be very costly. In one company, we implemented a simple program wherein if you walk so many steps, you get a lunch with the SVP. Amazing response. People are dying to have that date with SVPs, right? So there are creative ways to make it fun. There are creative ways to engage employees. There are creative ways to nudge them. There are creative ways to look at how to improve, measure, and all of that. And that is where the ASSOCHAM survey that came out says, even if you spend 1 rupee on employee health, there is a 6 rupee return ROI that you get. And if you actually control 1% of absenteeism, you save almost 20 billion in terms of savings. So there is savings, there is an objective, there is a tangible objective, not just productivity, not just CSR point of view, because you're human, all of you are focusing on your human capital. And if you take an example of a manufacturing company, or let's say you have a car, right? You're servicing that car regularly once a year, you're monitoring your car, you're checking your fluids, right? If you have a fleet of cars, you're doing the same. Now but as an individual, as a leader who's responsible for thousands of people, you need to do the same, is to measure, quantify, identify, evaluate, and that is where predictive analytics in terms of healthcare comes in. That is where preventive analytics in terms of healthcare comes in, and every initiative has to be personalized. It can't be a one-size-fits-all, and that is where I would say thank you. Please rethink all of your health initiatives, otherwise you're just shooting in the dark right now. Thank you.
Is there a few questions that we'd like to ask?
Thank you for the good presentation. And,
Thank you, sir.
Dr. Sai Kumar here, Head of Department of Human Resource Management in DG Vaishnav College. Your presentation was very much focusing on the physical health, and I'm afraid we want to know more also about mental health.
Health. Correct. So mental health currently, I mean, depression, if you look at, if you go back to the presentation, depression, first is obesity, second is chronic back, third is depression, right? So depression comes in multiple levels. One is because you are physically not fit and you are getting tired too often, you're getting frustrated and all of that. Then depression could be financial depression, depression could be relationship depression. And today a lot of effort is being put in. So there is a talk across corporates for mental wellness, but it's not completely there yet, right?
I have a feeling, because I'm not talking about the core psychiatric disorders, major psychiatric disorder. I'm talking about the minor problems like neurosis, personality disorders, which are creeping into the organizations without their knowledge, because the present recruitment tools are not so effective to screen them or filter them getting into an organization. Once they are into that, especially if somebody is having a very severe personality disorder, either paranoid personality disorder or ankastic or obsessive, when they get into the organizations, it becomes very difficult for them to manage themselves as well as others to manage them, especially the managers. It gets into very serious problems. So what are the things that you would advise the organizations to do that?
So to get started with, for stress, right, there are simple questionnaires, right, to actually identify people who are stressed at a 50,000 foot level, right? It doesn't have to be so complex. Simple basic questionnaire actually weeds out people who are stressed, and people who are stressed don't want to come out and say I'm stressed, right? So it has to be an anonymized survey questionnaire. And once you identify that stress, what we've done across multiple companies is gave them an opportunity to talk to a doctor, a psychologist, a coach, whenever they want, right? So it's more like, it's like talking to a friend right? I mean, and actually, people say it's always lonely on the top, right? And we are seeing more and more leaders use this more than frontline managers, because they need to speak to someone about that depression. And that is where there is once we identify there is a deeper depression, there needs to be a lot more coaching in identifying the root cause and managing it through for the next few months, right? So even that is now, if you look at, there are tools like Visa, there are tools like AI-based tools that are actually nudging an individual for saying, for example, have people who are not sleeping well, that's a sign of depression, right? People who are growing excessive weight quickly, that's a sign of depression. People who are eating, that's a sign of depression. So when you collect data, depression can be weeded out from the data passively, and then have a one-on-one conversation with them.
That's fine.
Start the next
Thank you,
session.
thank you.
Thank you so much.
sync up.
One size doesn't fit all, and I think that's what we heard throughout the session today. Health and wellness program should be customized to the specific needs of our employees, and wellness should become our culture. Huge round of applause to Mr. Kiran. Thank you so much.